the emergency department is that gateway. It
Yeah.
is the door into the hospital. It is the door into healthcare or access to our healthcare system, right? But if this space is the only space that has this requirement, what does it say in your experience about the outpatient setting and other settings where patients don't get that access, right? You just said it is you see them over and over again because um, they're guaranteed to be assessed and stabilized and treated for the bad thing that's happening right now. But then after they see you, after they see me, and they're discharged, what happens, right? The safety net to catch them kind of doesn't exist, and they end up right back in the emergency department, where they have the cushion of this law to say, hey, this has to be addressed again. And we're kind of in that like
Yeah.
roundabout
So,
system.
as we start to move into the space now with premiums going up, I can see this becoming more and more of a problem. More people are going to access the emergency rooms because it's going to be the only place that by law they can go to, right?
Yeah.
So we're going to see overcrowding, we're going to see longer wait times, increased mortality, mortality rates are going to go up as a result. So, I mean, you know, it'd be awesome if they could expand EMTALA into other spaces, right? Like, but the
But where's
financial
the funding?
I was gonna say that financial burden is not gonna
Yeah.
be sustainable. I mean, primary care already is
Yeah.
struggling. So, I don't know I mean, we know what the answer is. Fund healthcare. But, I think at minimum, I think this EMTALA is going to be what saves a lot of people,
Hmm.
despite there being these other cracks, and then even still, once they leave the emergency department, there's also an insurance side of medicines, right? Or prescription drugs. Like I had a patient the other day who's so much swelling because his insurance wouldn't cover his medications, and he's like, it's $700, and I'm like, sir, it's been 4 months. You could at least come back here. We would have given you a prescription, but then at what cost to the hospital once you become
Right.
a frequent flyer, right? So, it's just a never-ending cycle until we, as in policymakers and healthcare professionals, figure out how to make this work. And if we could expand EMTALA with funding across the entire system, I think it would work for everyone.